blend the two modules, prioritization and delegation, into one. We covered this some in junior seminar, and you've heard pieces of this along the way. And now as you prepare to graduate and take NCLEX, I felt like we should go over this and kind of cement it in for you. So prioritization is using priority, using judgment to discern among competing problems. Prioritizing care is the process to help you manage your time, establish an order of completing things for the best outcome for yourself and the patients. Ability to set priorities is critical thinking, and time is always a factor. Nurses have only limited time to make clinical judgments, perform interventions, and multiple objectives throughout their shift. So time management helps the nurse get everything done that needs to get done. And there's factors that influence patient satisfaction. The availability of the staff. How often were you there? Were you there when they needed you? Amount of time to meet patients' needs. Did they do things right? Were they effective? Did they do things where it helped? Were they effective and efficient? And how do you prioritize? There's several things there. I took some things from Kaplan, some things I've covered before in class, and from the textbook from Pearson to blend this together to give you the multiple ways NCLEX will ask your questions and how you look at it. It's not just about the NCLEX, it's how you enter your career, but of course focus right now is NCLEX. Everything comes back to the nursing process, assessing and planning, assessing and planning, assessing and planning. Always need to assess before you intervene. Assess to figure out what your next action, that's your planning, and then you intervene. If you don't assess, you cannot prioritize, which is the most important thing to do, the first thing you should do. And how do you know how to plan and if it was effective? How can you evaluate if you didn't assess fully? So there's the nursing process. Maslow's, it's our basic physiological needs and our safety. It goes in the levels. And then the ABCD, airway, breathing, circulation, disability. A thorough assessment needed to prioritize. After getting the information from the shift report, you need to make sure everybody is safe, the patients are safe. Do a quick safety check. Go through your ABCs, evaluating, becoming aware which patients might be at risk for things. Ask about whether there's any complex patient problems that you should know from the start. Are there special safety concerns for patients? Is there somebody that's confused and been climbing out of bed? Is there somebody that has a risk for harming themselves? Is there a family member that may be a safety concern? Time constraints. Note routine responsibilities and interventions still have time constraints. Even if it's not the priority, it is not the thing that you need to do right away. Medications need to be given within a certain time frame. Procedures are done in a certain time frame. Some things have time constraints. Even if you don't prioritize them as the first and second thing to do, there's time constraints. Know how many and what level of staff you have available so you can delegate. And we will be talking about delegation. You need to know where you're starting from because you don't take everything on yourself or you'll never get it done or not get it done efficiently and effectively. Know what resources you do and don't have. Are there feeding pumps? Are there IV pumps on the floor? Are there supply room there? Is the supply room have what you might need? And ask if there's any certain patient preferences, whether it be a religious belief or noise or something like that. Nursing process for assessment and implementation. Assessment's the first step of the nursing process and takes priority over all steps. As I said, you have to assess before you could anything. Cannot implement before you assess. Implementation is the care you provide to the client. On the NCLEX, you should assume that you have an order for all dependent interventions that are included in your choice. If it asks you about giving a certain drug, if it asks you about putting on oxygen, getting a blood draw, assume that you already have the order. It's for you to show that you know which is the priority in that situation according to the assessment findings you have. Refer to the question to determine whether you should be assessing or implementing. If it is an assessment question, eliminate any answers that clearly focus on implementation. And then choose the best answer. So are they asking you something about an assessment, a finding, or are they asking you about your action? Is it assessment or is it implementation? Time constraints, deadlines for completion of some nursing interventions, such as giving your scheduled medications. Priorities, setting priorities. Planning your day in advance is very helpful. It doesn't always go that way, but having a plan in place gives you some control and it gives you time to move within what you plan. Determining which activities must be completed at the expected times. What do you hope to get done by the end of the shift? What do you have to get done by the end of the morning, by lunchtime, by whatever? Essential activities not performed may result in negative consequences for the patient. Urgency factor. It's a way to illustrate how much time can safely lapse before a patient's health status is compromised. And we're going to break these down: non-acute, acute, critical, and imminent death. Urgency interventions may be affected by changes in the patient's condition, deterioration of patient's health status, complexities of patient condition. They may be non-acute now, but things can change. So non-acute is a low urgency. A delay would not negatively affect the patient. And acute is medium priority, low potential for patient's condition to become more life-threatening if intervention is not completed in a short time. Low possibility. Critical, potential for patient's condition to become life-threatening if interventions are delayed. So non-acute, low urgency. Acute, there's a low potential for a negative outcome. Non-acute, no potential for negative outcome. Acute, low potential. Critical, there is a potential. So acute, low potential if not in a short period of time. Critical, there is a potential for condition change if not done soon, if you delay your interventions. Imminent death, of course, is the most urgent. Action takes priority over everything else. A nurse must act immediately to prevent further deterioration and threat to death. So when you're reading questions and they're giving you the options and you have to prioritize, think of breaking each situation by itself into non-acute, acute, critical, and imminent death. Ranking priorities. Priority 1 is a must-do. Priority 2 is a should-do. Priority 3 is nice to do. It's like we do in teaching. You must know it. You should know it. It's nice to know it. So priority 1 takes priority over all other interventions. Priority 2, you should do, means that they're not essential, can be done once must-do activities are completed or covered. Priority 3, important to complete, but only after 1 and 2 can be done. Setting priorities of care when demands exceed time available. You get the most important things done first, the lesser priority activities get done next, and least important may or may not get done. Nurses should use their judgment to determine what they can delegate to unlicensed assistive personnel, because you can't get everything done yourself. Time management. Take into account specific considerations: the patient health preferences, patient's condition, unexpected occurrences, appropriate delegation of tasks. Proficient nurses develop a sense of how long it takes to complete an intervention. You won't have this in the beginning. It takes quite some time, so don't get frustrated with yourself. This will grow with time. Changes in patient condition. Patient needs to be monitored continuously for changing circumstances. Infrequent assessments can result in inaccurate or incomplete data in shift report. The assessment is ongoing. The sooner condition change is discovered and addressed, the more quickly the team can intervene to prevent further deterioration. Change may require reevaluating your priorities and changing plan of interventions. It's especially important when planning care for multiple patients. You plan, you think, but things change and you have to be able to adjust with it. You have to do assessments. You don't always do your whole head to toe, especially working on a med-surg floor. You need to get your head toe in there as early as possible to really know that patient so you could do a quick assessment later and know if something is changing. Okay, so that's the nursing process. Now, applying and prioritizing. So Maslow's hierarchy of needs. Maslow's theory was needs motivate behavior. You use the hierarchy in establishing priorities of care. Most important is in your red, physiological, and then your safety. And then we start getting into the belonging, esteem, and self-actualization. So the most basic physiological needs are at the bottom. More complex social needs are at the top. The lower needs must be met before you can move to the higher levels. Nursing process of Maslow's hierarchy are a guide to thinking critically about what order to address a patient's needs. So physical and biological needs. Some physical needs include the need for blood gases, the need for airway, breathing, circulation, your ABCs. Circulation is your cardiovascular function. Nutrition, sleep, fluids, hygiene, elimination. Those are physiological. They affect the physiological state, biological. Safety. Safety and psychological kind of blend in together. The psychological and emotional safety and security needs include low level of stress, low level of anxiety, emotional support, their pain or comfort level, the environment and medical safety, emotional and physical security. So with NCLEX, these are the two things you're looking at, physiological and then safety before you get to this. Love and belonging. The love and belonging needs to reflect the person's innate need for love, belonging, and acceptance from others. So how do you prioritize with Maslow's hierarchy of need? The low priority resolve with minimal intervention, no significant dysfunction. Problems can typically be resolved easily with minimal interventions. They don't cause significant problems. Medium priority, unhealthy physical or emotional consequences, but not life-threatening. High priority, life-threatening problems, potential to become a life-threatening problem in the short term. Again, that's how you prioritize. If it's a life-threatening or that has a potential very soon to become life-threatening versus it has a potential but it's not right away and it's not life-threatening, that's how you prioritize those. There's the Maslow 4-step process. So step 1, look at your answer choices and determine if the answer choices are both physiological and psychosocial. Step 2, if your answer choice is physiological, don't eliminate it yet. Eliminate the psychosocial answer choices first. Although pain certainly has a physiological component, reactions to pain are considered psychosocial, so they're a lower priority. Button. Try that again. Okay. Step 3 of Maslow's 4-step process. Look at each of the answer choices that you have not yet eliminated and ask yourself if the answer choice makes sense with regard to the disease or situation described in the question. On how much I can stress that. What is the question asking you? If you need to jot it on a piece of paper, say it out loud, hold your finger over it. This is the process or situation we're looking at. So just because it's a really good choice that has to do with airway, is airway part of your situation? If it makes sense as an answer choice, keep it for consideration and go on to the next choice. Step 4, can you apply the ABCs to the answer choices? That's a priority. What if the ABCs don't apply? Then compare the remaining answer choices and ask yourself, what is the highest priority? And that is your answer. Safety. Nurses have the primary responsibility of ensuring the patient safety of the clients. Safety includes meeting basic needs, oxygen, food, fluids, things like that, physiological needs, reducing hazards that cause injury to clients, such as accidents, obstacles in the home. So we talked about environment was mentioned earlier, and decreasing the transmission of pathogens, such as sanitation and immunizations. Those are part of safety. So, safety, step 1. Are all the answer choices implementations? If so, use the safety strategy illustrated above. Step 2, can you answer the question based on your knowledge? If not, continue to step 3. Step 3 is ask yourself, what will cause the client the least amount of harm? And choose the best answer. The ABCs. ABCs are always the greatest priority: airway, breathing, circulation. Then there's a MAAUAR, MORE method. MAAUAR. M for mental status, A, acute pain. Second A, acute impaired urinary elimination. U, unresolved or unaddressed needs. A, abnormal diagnostic tests. R, are risks. All concern the problem addressed with the second level priority needs. Delegation. How do you delegate? What can you delegate? New RNs are often fear being responsible for negative occurrences and unsure of which tasks they can give to unlicensed assistive personnel. They don't see themselves as leaders. You are about to graduate and become a registered nurse. You are a leader. Delegating tasks to other nursing staff can improve management. You delegate to LPNs and unlicensed assistive personnel. RNs must be aware of legal responsibilities involved in delegating. Nurses who delegate tasks must evaluate the task on its completion. You're still accountable and responsible. Delegation requires mutual trust and demonstrates trust in staff members' abilities. Accountability. Accountability within the nursing context refers to nursing professionals' legal liability for their actions related to patient care. When you delegate, you're transferring responsibility and authority to the person or persons you delegate it to, but the delegator, that's you, always always keep accountability for the task completion. Just because you delegate it to somebody to do, it is still your responsibility that it gets done properly, and that you evaluate it. The registered nurse is always accountable for the overall outcome of delegated tasks based on each state's Nurse Practice Act provisions. Scope of the registered nurse. The scope of a registered nurse will most likely include the legal ability of the registered nurse to perform all phases of the nursing process: assessment, diagnosis, planning, implementation, evaluation, ADPI. That is the scope of a registered nurse. Assess, nursing diagnosis, plan for that diagnosis, implement and evaluate according to your nursing diagnosis from your plan. The scope of the LPN. The LPN, practical or vocational, includes a legal ability of this nurse to perform data collection, plan, implement, and evaluate care under direct supervision and guidance of a registered nurse. The registered nurse has to do the assessment. You start planning things out. You tell delegate to the LPN what they can do. They do, according to your assessment, what you've planned. They make an implementation, they evaluate, but the RN is still responsible to come behind them and evaluate also. Unlicensed assistive personnel. Assisting the client with their activities of daily living, such as ambulation, dressing, grooming, bathing, hygiene, measuring INO, getting vital signs, height, and weight. They can do non-pharmacological comfort interventions to maintain a comfortable environment. They can do a therapeutic back rub. They cannot put oxygen on a patient, and some of you picked that on the last question. You weren't looking at the fact that you were speaking of what the unlicensed assistive personnel could do. Observation and reporting changes in and the current status of the patient condition and reactions to care. They're not assessing, they're observing and reporting. They are assisting, measuring, providing comfort, observing, reporting. They can transport clients, they can transport specimens, they can do other errands, they can stock supplies. They can do range of motion, they can assist with range of motion, feeding, ambulation, and other tasks. They can make beds, assist with bowel and bladder functions. Do not delegate to an unlicensed assistive personnel assessments, nursing diagnosis, establishing expected outcomes, evaluating care, and any other task and aspect of care, including those that entail sterile technique, critical thinking, professional judgment, and professional knowledge. 5 rights of delegation. I have these and then I break them down. The right task, right circumstance, right person, right supervision, right direction, right communication. So the right task. Which tasks are legally appropriate to delegate? Can I delegate these tasks based on your organization's policies? Generally, registered nurses are responsible for their assessment, planning, and evaluation. These actions should not be delegated to someone who is not a registered nurse. Correctly answering these questions will require familiarity with Institutional Nurse Practice Act guidelines. The right circumstance. Are appropriate equipment and resources available to perform the task that you've delegated to them? Does the delegate have the right supervision to be able to do that task? Is the environment favorable for delegation in this situation? Patients who are or may become unstable and cases with unpredictable outcomes are not good candidates for delegation. So one example, you would not delegate to an unlicensed assistive personnel to assist the feeding in a patient who is high risk for aspiration or has a complicated specialty diet, because then it may not be safe. Right person. Consider if the potential delegate has the requisite knowledge and experience to complete delegated tasks safely, especially concerning assessed patient acuity. So part of your assessment, you're getting their acuity as you plan how to delegate. Before delegating tasks, the registered nurse must know the delegate's job description and previous training. Ask, have you had training in this? Have you done this before? Have you done this task on a patient? Have you done it without supervision? What problems have you encountered when you've done this task in the past? Right supervision. The Nurse Practice Act requires the registered nurse to provide appropriate supervision for all delegated tasks. Following task completion, the RN is responsible for evaluating the outcome of the task with the patient. Registered nurses are accountable for the evaluation overall patient outcome. Right direction and communication. Communicate performance expectations precisely and directly. Do not assume, never assume anything. Do not assume the person you have delegated to knows what to do and how to do it, even if it's a routine task. because you are ultimately accountable. But again, you can't complete everything yourself. Consider whether the delegate understood the assigned tasks, directions, patient limitations, and expected outcomes before the delegate assumes responsibility for it. Delegate must comprehend what, how, and when to report back after the delegated task is complete. Delegates need a deadline for task completion for time-sensitive tasks. Hopefully that was helpful, and this will help you along with your other 2 little videos I gave you to watch so that you can really perform your, your discussion board. These are some of the references I want you to use. So that is the end of this lecture recording.